The opioid crisis, the worst medical epidemic in the U.S. According to the Centers for Disease Control and Prevention, drug overdose is the leading cause of injury-related death in the U.S. In 2017 alone, almost 68% of the 70,000 drug overdose deaths involve a prescription or illicit opioid. Therefore, in October of 2017, President Trump declared the opioid crisis as a public health emergency. In 2001, the Joint Commission released pain management standards. At that time, pain was reportedly undertreated. The standard required that every patient will be assessed for pain and treated to achieve comfort. Pain was referred to as a fit vital sign. Furthermore, effective pain management was tied to patient satisfaction scores and reimbursements. These demands led to overprescribing of pain relief medications like opioids. Vicodin, OxyContin, methadone, and fentanyl are some examples of pharmaceutical opioids. Opioids are very strong pain relievers that are effective for acute and severe pain expected after surgery or injury, but it carries a great risk of opioid disorder and overdose if taken for a longer period of time. In a public statement, the White House declared the president implemented a safer prescribing plan that will cut opioid prescription fills by 1/3 within 3 years. In a related news, the CEO of a big healthcare organization has mandated all physicians to follow 4 steps to prevent overprescription of opioids. These are: avoid new patient dependence on opioids through safe and appropriate prescribing. Second is avoid polypharmacy with opioids. Third is help people with high doses of opioids to taper safely while offering support and a personalized care plan. And fourth will be screen for presence of risk factors such as alcohol dependence or the presence of children. The physicians have also voiced their concerns, and this is what they said. We have noticed an increasing number of patients dissatisfied with their current treatment. Physicians are worried about being questioned by the licensing board, and so they refuse to prescribe opioids even when it is appropriate to do so. Our chronic pain patients are having a difficult time with a taper, and we are constantly being bombarded with grievances. The patients are also voicing their concerns. One concern would be, I'm not a drug addict. I need my OxyContin to make me comfortable enough to get up and drive to work. With the everyday pain that I feel, I have tried physical therapy and acupuncture, but nothing eases my pain like my OxyContin. Another patient also said, I have been taking my pain medication for years. My doctor and I found the right dose for me, but today we talked about tapering my dose because of the risk of overdose. I am scared that my pain will be out of control again. The nurse who is caught in between the doctor and the patients have said patients have come out from the doctor's office frustrated with the treatment options that were offered. No one deserves to live in too much pain. I feel bad for these patients, but I understand why we cannot give them what they want. The opioid crisis is still on the rise, despite government regulations and tight monitoring. It cannot be denied that there are many patients with unaddressed needs and are suffering with pain. To close the gap of regulation and practice, all stakeholders should aim to increase awareness through education, improving access by promoting insurance coverage to alternative treatments, and collaboration to find the best evidence to treat patients with chronic pain. Thank you.